What's up? Good afternoon. Today is April 15th, 2020, and I am recording from the North Metro of Minnesota. So today I'm just gonna, I've seen a lot of people do this online worldwide, so I'd like to share with you guys my experience with COVID-19. No, I wasn't officially diagnosed because in the state of Minnesota, they're only testing healthcare workers and senior citizens living in long care facilities, so nursing homes and assisted living programs. So if you're still here and you want to hear it, great. I'll explain to you what's going on. I'm going to start from the very beginning when I first started to realize I was getting sick. And that was March 6th, the day before I left for my trip to Ely with my college group. That whole time, I had a sore throat that lasted one day and then a nose running like an open faucet. It was terrible. I didn't feel better till the last day, of course. Then that last day, a lot of people in my group were coughing with the sore throats and the runny nose. So I was like, oh, shoot. I think I got everybody sick. But I didn't cough on anybody because I wasn't coughing, and we had our separate cups that were labeled for when we were drinking stuff. So I was like, huh. And then the 13th came around. It was time for us to go home. We didn't have our phones being in the Boundary Waters. So as we were heading back to the cities, we're like, why is there a toilet paper shortage? Why did our spring break get extended? What's going on? And we're like, oh, I guess the coronavirus is in Minnesota. And so my mom picked me up from the college to take me home, and that's when I found out 21 people in Minnesota were infected. So I got a little list I wrote down to keep me on track, so I'm going to go off of that. So when I got back on the 13th, my boss had given me that day off to recoup. And then that Saturday, the 14th, she had me work 3 to 11. And that's when I realized I was getting worse. I actually debated on going in after my shift, but when I got home and was able to rest, I was fine. Sunday, I thought I was fine. I never work Sundays, my day of rest, go to church, come home, be fine. No worries or cares because I'm feeling better. Monday, I was supposed to work 7 to 3. I worked 3 hours, and I was like, what is going on? Okay, that's March 16th, the day before St. Patrick's Day. So I was like, this isn't normal. Like, I have asthma, so I usually have difficulties breathing, but the inhaler usually helps that right away. I wasn't getting relief. I looked terrible. I was around a lot of people in the Boundary Waters, so my boss is like, dude, you need to go get looked at. You don't look too good. And keep in mind, my boss has underlying health conditions, and a lot of the people I work with also have asthma, oddly enough. I knew I didn't want to get them sick, so I agreed, and I went in. So I went to the ER north of my house. She listened to my lungs. I got in right away because I look like poop. So she's like, okay, well, I'm going to have you sit in this corner. We'll get you back in as soon as possible. My friend is on the phone with me, keeping me calm. I got called like 5 minutes later, oddly enough, so I jumped the line. The doctor first listened to my lungs, and she's like, okay, you sound coarse, meaning that's fluid. So she wanted me to get looked at for a chest x-ray to see if there's stuff in there. So they took the picture, brought me back to my room. I did not have a fever, oddly enough, but I never fever. Waited for the radiologist to look, and then they're like, yeah, you got pneumonia. So because I had the pneumonia, I had to miss a week of work, a week and a half. So I was like really bored. And then I was finally able to go back to work after that week, a week and a few days. And I felt fine. At least I thought I did. So I celebrated my sister's birthday with her, my Irish twin's birthday. I worked 2 weeks, I think, if I'm doing my math right, and I wasn't getting relief. So I called the doctor and I was like, hey, I'm not feeling better. Went back to see her. She redid an x-ray because the struggle to breathe was real. And at the time, the antibiotic the doctor gave me when I first went in on the 6th, which she gave me doxycycline, which is also used to treat Lyme's disease, which I happen to have chronically. I live right in the bullseye of it here in Minnesota. That gets the worst of it. So I did that. I took it as prescribed, and I wasn't feeling better. So that brings me back to me calling my doctor and be like, hey, this isn't working. I don't think she gave me the right antibiotic. They were actually able to get me in that same day I called. So I went to my primary doctor. She's like, well, it looks like from what we see in the x-ray, the infection's gone. I have like a low-grade fever at this point. It's like 98 something. Well, I wouldn't say low grade. It's 98.9. So they're like thinking, not a big deal. Let's just change your antibiotic and give you some prednisone because it seems like you're definitely still fighting something, symptomatically wise. I had a week later finished that antibiotic and the prednisone, and now I'm really starting to feel sick. So, and I couldn't do anything. I couldn't even bring a basket of laundry up the stairs without being short of breath. And I still continue to work because I got to make money somehow. I ain't making money just staying at home. And after having the pneumonia, I was religiously checking my temperature for fever because I didn't want to go to work if I had a fever because that meant I was contagious. So from April 3rd to the 6th, that's when I went back to the ER because the 5th, April 5th, I felt like I got hit by a truck. Like I went to sleep and then I woke up and it felt like I got hit by a truck because that whole Sunday I was fine. I watched a movie with my dad. I went fishing with my sister. I was feeling fatigued, so I went to sleep and I woke up and I felt like I got hit by a truck. My face was pale. I was sweating. I was struggling to breathe. I was like, I'm not going to go to the ER. I don't want to raise another bill, even though I had health insurance, but who wants to go to the ER? Let's be real. It's a pain in the butt. Monday, my sisters finally convinced me to go in. Now we're at April 6th. I get there. They have a different section in the ER for people that present COVID-19 symptoms. And when I went in, I had a fever, chills, the sweats, short of breath, and dizziness from trying to breathe. And oddly enough, she didn't take an x-ray. She listened to my lungs. She was watching my O2 stat, which was at 95, which is kind of low for me because I'm usually at like 97. So I was struggling, and she called COVID-19 on me. And I was confused because it was like, you can't diagnose me with something you haven't tested me for. And what her diagnosis she did give me was an upper respiratory infection caused by a virus. And of course, that fits COVID-19. So she basically said I had it, and I asked her if she thought that's what it really was, and she said yes. So I had to let both bosses know, because I had just worked my second job Saturday. I had to tell them, hey, so I'm sick. I felt like I got hit by a truck Sunday night. So I finally went in Monday, and here's what's going on. Another week and a week and a half off of work. So from being sick from this pandemic, I had lost literally 3 weeks of work, a lot of money. Thankfully, this Monday, though, the 13th, I got my stimulus check. So that'll help me a lot. I had to tell my parents because they work with people that are high risk, and it was a pain and a half to try and get a doctor's note stating that's what they thought it was. They said they couldn't do it because it was illegal, and they can't even test regular people like me for COVID-19 because you have to be a healthcare provider or a senior citizen living in assisted living program, nursing home, like I stated beforehand. But from what I heard today on Facebook, give or take, trust or not, there's supposed to be a test for antibodies of the virus. I may do that just to know if that's what it was, if my insurance will cover it. So at this point, after telling my family, the doctor said it was COVID-19. We were like scared. No, I didn't want to get them sick. So I isolated myself in my room that whole week. My worst day was Wednesday, a week from exactly 7 days from today, I can say. I had a fever of 101.7, like sweating and struggling to breathe. Like, I know I have asthma and it's already, depending on the weather in the day, kind of hard to breathe. But if you want to know what it's like, how I was feeling, if you put your hands under your rib cage, like push firmly and then try and breathe. It's really restricting and it's really hard to breathe. But that's basically how I was breathing for 2 weeks. I was breathing like that. On my neb, the same solution you'll get at a hospital, every 4 hours, drinking a lot of water and yellow Gatorade, in particular for electrolytes, because that's what the doctor said would help. And I wasn't too worried about myself, like dying from the virus. As soon as she told me that's what she thought it was, the first thing that came to my mind is my family, my parents who are high risk, and my coworkers that are high risk. Because I literally thought and felt like I was going to kill somebody. I was basically a walking weapon because I had this virus. I work at a gas station, and I was working a fast food drive-thru. I see, if I'm working both jobs the same day, well over 300 people a day. But at that time, I didn't have a high enough fever to be contagious, but still, I was just in complete shock and denial of that's what it was because they didn't test me. I didn't want to believe it. But that Wednesday when I had the fever of 101 and struggling to breathe, I finally gave in and yeah, this is what's probably going on. Thursday, I started to notice a slight improvement of my breathing. Friday, I kind of plateaued. Saturday, my struggle was starting to get better. So I started drinking lots and lots of water. I was sleeping a lot, kept up on the yellow Gatorade, and throughout the week I was taking Tylenol for fever and some really, really good Advil because I heard that ibuprofen, I guess, makes it worse, and I don't take ibuprofen because it's hard on your stomach. So what I'm calling it an Easter miracle is I woke up. I haven't seen my family all week, so I really wanted to spend Easter with them. I was going to wear an N95 mask if I had to, and I had bought them candies, Easter candies. So it's been a week since I really talked to my parents, gave them their candies. I took my temperature, 98.8, and I noticed that my breathing, with help of the neb and the inhaler, was significantly better. And that day, I had went 24 hours finally without the help of a neb or inhaler, and I just threw my arms up, and in sweet victory in the name of Jesus Christ, I was like, I'm finally starting to get better. And then I took my temperature at the end of the day, that day, 98.0 flat. I couldn't have been any happier. And these past few days, I've been at 98.3, 98.5, normal body temperature. I'm actually at my second job. They're allowing me back to work, so that's really cool. And I had a lot of people checking up on me, had a lot of people calling, asking if I was okay. I'm fine. Now I'm fine. As you can tell, I can talk, I can breathe, my face isn't pale. If it is, because I'm cold. I live in Minnesota. There's still snow on the ground. Kind of upset about that, but yeah, so on a YouTube video I saw, I can't remember where their source is, but 85% of COVID-19 patients will have a slight to moderate, that's where I was sitting if that's what it was, difficulties with the virus. So those are people that can stay out of the hospital, they can maintain their own symptoms. 15% of COVID-19 cases require hospitalization, such as being needed supplemental oxygen. And then 5% are critical, and those are the folks that need ventilators to push the fluid out of their lungs. Because in severe cases of COVID-19, you will get pneumonia really bad, which I had. So it's not that bad. The county I live in, last time I checked, had, I think, 78 cases. And then I think Minnesota as a whole, today we are close to 1,700 cases as a state. And I can't remember the death. I will post that stuff in the comments though, or I might post it in the description. I'll probably just post it in the comments. But how I am feeling today, after finally being better over a month, I will say this, that was the worst sickness I've ever had. I get a cold or flu, it lasts a few days and I'm good to go. I don't even fever, I'm still able to work and whatnot. But this virus, this pandemic has severely impacted me financially as well as emotionally, and maybe I can slightly, fairly enough, say mentally. It was not fun. I'm breathing fine. I feel like I'm definitely at 100%. Like, I'm stoked to be going back to work, to make money. And I'm gonna call my doctor and ask her if the antibody test would work for me to see if I did have it, if it's open to the public. But my heart goes out to anybody that's been affected by this virus. I know that a lot of people are dying from it. So, rip to them. Rip to all the victims of this. My heart goes out for small business owners, people that are struggling. We're still under stay-at-home order in Minnesota until May 14th as of today, but knowing the governor, he's probably going to push it back more, but I really don't have a say. The only thing we can really do is cooperate. As long as he doesn't close down the lakes, I'll be fine, because I like to go kayaking and fishing as a de-stressor. But I have a feeling this is going to be like a 20-minute video, but that's my experience with possible COVID-19. It was the worst thing ever. Not being able to breathe like that for a long period of time was horrible. Not being able to see my friends and my family, just being stuck in my room. I had Minecraft, and FaceTime and other stuff, but we need social contact. We're humans. But you guys, stay healthy, keep fighting, stay 6 feet, keep a distance, wash your hands, stay at home. Best advice, just stay at home. Only go out if you have to. Take care of each other. I'm hitting 20 minutes, so I'm going to sign off. Just y'all stay safe for me and stay healthy, okay? So I'm going to close this up, and let's keep our fingers crossed that this will go away soon, because we need summer. But with that being said, y'all have a good day. Be safe, be happy, and be healthy.